Hello, I'm Dr. Maurie Markman from Cancer Treatment Centers of America. I wanted to briefly discuss a very important, a very provocative paper and topic. The paper is entitled Cervical Cancer Stage, a Diagnosis and Survival Among Women 65 Years or Older in California. The paper was recently published in Cancer Epidemiology, Biomarkers Prevention, 2023, volume 32, issue 1, pages 91 to 97. In this particular analysis, researchers looked at data from the California Cancer Registry, a total of 21,442 patients over the age of 21 with their first primary diagnosis of cervical cancer between 2009 and 2018. Of considerable interest and concern, 17% of this population were over the age of 65. In addition, and perhaps most concerning, patients over 65 who were diagnosed with cervix cancer had a higher risk of having advanced stage of the disease. In fact, women over the age of 65, 71% of patients presented with late stage disease compared to only 48% in women under the age of 65. Obviously, those numbers are all too high, vastly too high with cervical cancer, but it's notable that women over the age of 65 were even worse than the whole population. The point to be made here is that there have been recommendations that have been made, solid recommendation based on data that women over the age of 65 may not need routine screening for cervix cancer. It's always been clear when these statements have been made that this relates to a population of women who have had routine screening throughout their much younger years for decades. And if all the screening has been negative, then perhaps you can stop after the age of 65. That does not relate to women who have not had proper screening. So it's clear to emphasize that if one encounters either an OB/GYN practice or primary care practice, or family medicine practice, a woman who is older, 65 in that range, who is not proper screening, she needs screening for cervix cancer because of the risk of this disease in that population, which is real and potentially very serious. I'd like to call your attention to this paper. The analysis is important. The data are quite relevant. Perhaps we need to modify some of the recommendations we made for screening, or at least emphasize what those screening recommendations mean in terms of discontinuing screening at an older age population. I encourage you to read this paper. If you encounter this population in your own practices, I think it's an important paper, an important analysis, and I thank you for your attention.